has a fever, and he's had a fever, I guess, since Monday night.
Okay. Is he drinking?
Well, he nurses still, and he did just have a little bit of water.
Okay, wetting nappies?
Yeah, and...
As much as normal?
Yeah,
Good.
yeah.
Okay, so we're keeping hydrated.
Yeah.
And what about solids?
He ate dinner the last 2 nights, which I was sort of surprised by, but then...
Well, you are a hot dog.
Nothing else
39.1. That's a sporting temperature, mister.
Yeah.
And then take that off completely, mister.
Cry-moany.
Oh, Bobby. Oh, hello. Is that funny? Still a smile, sweet boy.
You're so hot.
I know. If you're feeling miserable, the last thing you want is this, but it's okay. Okay, man. Right, we need to have a little look at that throat as well, sweetheart. He won't like this very much, mister. So one hand firmly on his head. I'll just try and do this once because he won't like it. I know, darling. I know. Sorry. Good boy. In a way, it's quite reassuring that he's cross, because if you do something they don't like and they don't fight you, you worry more, actually. I think he's probably got a chest infection.
Okay.
What we need to do is start some antibiotics today.
Okay.
He's on that borderline of needing to monitor him. The breathing at the moment, he's coping, but if it gets any more laboured, then it would need a little bit of help.
Okay.
And in terms of being, say, in a safe place. I'm not saying he'd need oxygen, but I want you to be in hospital.
Okay.
So sending a child to A&E, you send a child to A&E when they obviously have an illness or a situation which you cannot manage safely in general practice.
Okay, it's not that upsetting. It's not that upsetting.
If he had been very limp or listless, not fighting back, then we would have called an ambulance immediately, because that's a life and death situation.
It's good to see you drinking, mister. That makes Dr. Taylor feel happier. Right, ready?
Okay.
All right,
I know you don't like it. I know.
Right, let's... Good boy. Good boy. Well done. Done.
Okay, there you go.
Well done. I think Mummy might need to get some of those. It might be easier for her, actually. And the next thing we're going to do, you're not going to like either, sweet pea. I know. But then we'll get you better, OK?
Thanks.
This is going to be your one.
It's like a little bear.
Teddy.
Aww.
I know, sausage. Real tears. Right, mister, right. I know. 1, 2, good boy, 3.
I think it's very difficult to balance, what needs to be done with worrying about both the baby, obviously, in the first instance, this baby's struggling to breathe well, but also that mother's terrified, so you've got to look after her as well, and what you need is her cooperation in that situation.
5. It's okay, darling. Oh, okay, break down. Sweetie, the sooner we do this, the sooner it'll be over. I know it's horrid. I understand. I know.
Sometimes you have to be quite firm with parents, that you need to do what needs to be done right now, because otherwise, the child could suffer. But it's just about being caring, but being firm and calm. It's difficult.
Good boy, all finished. So done, you super boy. I know, my darling, I know. Sorry, my love, it's horrible for you as well. Well done, because actually he'll forget this. You're the one that remembers. Well done. So we'll sit for half an hour or so. Okay, and then I'll bring back in and check his breathing again, and then we can decide what we're going to do. Is that okay? Good boy. There we go.
It's about making a judgment call when you see a sick baby. Having done a lot of paediatrics and being a paediatrician in hospital, I have certain skills that mean I can make that judgment. So the important thing is to look at the whole situation and assess that child constantly and how the breathing is and how that child responds, which is why I wanted to see the child again, so keep them in the waiting room and reassess them, because had he got much worse, he would have needed to go to hospital.
Pull your hip into your chest forward, gosh.
I'm afraid what I'm also going to need to do is just examine your back passage.
Oh.
Sorry, that's sore.
I'm still getting more and more bloated, although I'm not sure about... I don't think I'm putting weight on.
Obviously, it's bad. It affects you every day.
Also, recently, I wake up and I feel, yuck. But that goes away.
And the air, the wind, it comes out at both ends or one end?
Not so much out the top, but since I went on to Sawyer,
Yeah.
I don't get so much.
Okay, so the top end is a bit
I get
better.
some up, down as well as up, but
But it's more the actual bloating.
that's more the actual
not the
bloating
wind.
itself. I mean, all the time it gets bigger and bigger.
Yeah. Okay, shall we have a look?
A mother will need a hand to get up with.
Is this the right height?
Oh yeah, I should think so. Presumably at least you've got the jacket on.
I want to get to your stomach.
Right. You see, I could even walk that far.
Yes, now you can. It's good, isn't it?
It's a great improvement.
Yeah, I think that is. So, you can do this yourself. Wow. You are more mobile, aren't you? Head. Up. There you go. Okay, too high. Use this. So, is this a good day or a bad day in terms of bloating?
It's just every day is the same.
Normal. So it's not bigger than normal.
No.
Or smaller than
Yeah.
normal. Okay, I'm just gonna press. Tell me if
Yeah.
you get any pain. So that's the wind.
Yeah. And I can feel the pressure because the wind up. The wind is there.
Yeah. So
Now when
is
you
it
do that,
Yeah.
I get a slight pain there.
lower down?
Yeah. It's discomfort as opposed to pain.
Yeah.
Don't forget I've got a hernia.
Yeah.
There and there.
Yeah.
Ow.
Pain.
Pressing there was the pain.
Pain
down
there.
below.
Still
No.
painful?
No, it's not painful. It's just discomfort now.
Discomfort. Okay. Just gonna tap.
Yeah.
Okay. And then if I can get you to take a deep breath in and out, and again.
Ow.
That was painful.
That hurt there. Yeah.
It's catching. It's just full of wind.
Yeah.
A lot of wind.
A lot of wind.
And I think the wind is what I caught here, as
Yeah.
in your bowels got wind in it, air
Yeah.
in it, and then it got caught between, because that's
Yeah.
the test, we're
Yeah.
trying to feel the liver, and that's catching the bowel between, and that's when you got that
Yeah.
sharp pain here. And pressure here, again, is putting pressure in this area
Yeah.
because of that wind. So it's this wind. So let's get you back up.
Right.
But the question will be, how do we get this wind out? Because that's the problem.
Quite.
It's the wind there that's causing the discomfort. It's the
Yeah.
wind there that's giving you this unease.
Yeah,
I
unease.
suspect.
Yeah, and also, of course, it's the bloating which gets bigger and bigger and bigger.
Yes. What about just other things such as peppermint tea?
I drink tea.
You're not a keen.
I drink 1 mug of tea at breakfast.
So I think, let me think about this because I'm not sure.
No. Right.
So,
Tor.
How are you doing? Come back in.
You seem like you wanted to play a little bit.
Okay. Hi, gorgeous.
Yeah.
Hello.
Take the shirt off again.
Yes, please. How are you doing after that little bit of medicine?
But he's still got that. I'm so pathetic.
Oh, I know. Now you're gonna. I know.
It's okay.
Oh, buddy.
It's okay.
Yeah, you used to like me. You're never gonna like me again, now, are you? I know. Will you forgive me, darling? I'm just trying to make you better. I promise.
I know. Thank
Okay,
you.
we'll come down a little bit, Mummy. We've come down half a degree, so that's not bad for the time you've had, actually. So I think we just need to be really on it with the medicine. Bam, bam, bam. Okay. What can we give you to look at? Why don't we just watch your breathing for a minute?
No, but you like this. You like this a lot.
Okay, your breathing's got a little bit slower too, so that's also good. Oh, Ben. Hey, what's this? You didn't mind this one before, remember? Ben's turn. Good boy. Ben's turn. Good boy. It's interesting. I can hear much clearer now. So there's definitely some noise in his chest. He's definitely got a chest infection.
Okay.
So we'll definitely treat him with the antibiotics. I'm going to give you that to take home. Okay. I want you to give him. I know it's a battle. When's your husband home?
He'll be home in an hour. more.
Great.
Yeah.
When there's the two of you, give another 10 puffs. You can do it in 2 lots of 5. So did you see it? It doesn't matter if he's crying because he's still inhaling it.
Yeah. So breathe
Do
in.
that, and I'm going to give you a call at 6 and to see how things are. If he's not getting better by 6 and you're worried, then you can bring him back and see me again, and we'll make a decision about A&E or not. Okay. And I'll call you. I'll put you on my list to call at 6. Okay.
Thank you.
All right, darling.
Bye.
Bye. Yeah.
If I can't get it out, you may have to go to the hospital and have it removed. All right.
Do I have to have it removed?
Well, it could cause an infection, so I don't really want to leave it in there.
I can't believe it.
But you shouldn't be using anything in your ears. No ear cat and bull buds, whether they're cheap or not. I'm hoping the water pressure will bring it out.
Can't you stick some tweezers in there?
No, I can't. I can just do a small syringe, but hopefully it'll do the job.
Yay!
And that'll teach you for using earbuds. It's out.
Is it?
It is.
Yay! Okay, thank you.
So you're suffering with your legs, aren't you?
Yeah.
What's the matter? Oh,
I know. What happened?
so what happened there? You were bitten by a fly at the weekend, and then it became swollen.
So this was the bite, which is pretty, doesn't look bad anymore.
I don't know. It looks pretty nasty to me.
It was really red. It was like quite bright
Yeah.
red, and then the red was kind of coming down, but it was nowhere near this.
So it's got
swollen.
worse. And my
But
colleague
today,
gave
only
you
today.
flucloxacillin.
And I've been taking that.
You're not responded. Have you got a temperature? Let me take it. Let's see.
So this weekend I went away, and the swelling was going down, and I walked for a couple of miles, and nothing. There was no problem.
Do you think you were bitten again? I don't know. Let me have a look.
But it hasn't been. I don't know. Last time I felt a bit sick and dizzy, but I don't feel sick and dizzy now.
You don't have a temperature. Let me have... Can I feel that foot?
Yeah. So last night it became.
Oh, yeah, no, this really looks infected, yeah.
Really itchy. Can you see it's
And it's
all
hot, isn't it?
raised, and it's just mash up. But it's become much worse today.
It's worse, isn't it?
Much worse. So
Yes, I need to give you a stronger... 2 things. I'm going to give you a slightly stronger antibiotic. And I'd like you to take an antihistamine, because I think here there's an element of infection and of allergic type reaction, possibly.
Okay. Oh, that's going to give me a horrible thrush, isn't it?
Probably, yes. But I think I cannot not give you antibiotics. Yeah. Yeah.
You're crazy. You don't know what you're missing out on. Lion King musical is amazing.
Yeah, I'm sure I'll see it at some point. I want to watch 1984 as a play.
Yeah. Have you seen Wicked?
I'm going to watch Book of Mormon at some point, I think September.
What?
Book of Mormon. That's
Oh,
supposed to be
okay,
good.
yeah, I've heard that one.
What can I do for you? Well, 3 things recently. My mother's died, and she was ill for over 6 months, and I looked after her for that time, and she lived in Middlesbrough in the northeast of England, so I haven't been in contact here at all for the best part of this last year.
Right.
The immediate problem was that I thought my water tablets had stopped working because for the last 3 weeks my feet have been enormously swollen. Since I booked the appointment, they've gone down.
Right, okay.
Secondly, with being with my mother for so long, and she was bedbound for most of that time, I was sitting with her for hours on end, so I put on a lot of weight, and my general fitness has plummeted. And both with the death, but also the drawn-out final months, I've been really depressed to the extent where I've got to use CBT techniques just to do anything. Physically, I'm a wreck. Psychologically, I'm feeling absolutely rotten at the moment.
So you're talking about doing CBT techniques. How is it that you know how to do that?
I'm a psychotherapist.
Oh, right, okay. What do you think should be done to help you about your depression?
I think I could do some medication.
Right, okay. You're familiar with the PHQ-9 scale?
Yes.
Yeah, so can we just do that with you?
Yes, of course.
And see how you do on it. So the PHQ-9 is a set of 9 questions which are really quite helpful diagnostically in deciding whether somebody really is significantly depressed, as opposed to they're just feeling a bit low some of the time. In the last 2 weeks, how often have you been bothered by feeling little interest or pleasure in doing things?
Nearly every day.
Down, depressed or hopeless?
Nearly every day.
Trouble falling asleep?
Every day.
I think it's unfortunately the case that whatever expertise you may have, it doesn't really protect you in a medical sense from becoming unwell. So Paul is a psychotherapist, but that doesn't mean to say he can't be anxious or depressed or have any other psychological problems and actually struggle with them as much as anybody who didn't have that kind of professional training, because it's very different sitting in the chair as the therapist from sitting in the chair as a patient. And often, however much you know as a therapist what you would be saying to yourself as a patient, you can't hear it when you're the patient. Difficulty concentrating?
More than half the days.
Have you thought that you'd be better off dead?
Oh, yes.
Right, okay.
I am opening my bowel, but only very small.
Okay.
You know, I'm not doing big stalls
Okay.
like I used to.
Sometimes I feel as though my knee is collapsing, and sometimes I feel as though my hip is collapsing.
I've had difficulty getting up, you realise
I'll
that?
help you.
I'm 75 next month.
Mrs. Sales, hi.
Oh, it's you, is it?
Oh, disappointed? You're disappointed in that?
Yes.
Why is that? I thought you loved me.
On and off.
On and off. And today's an off day.
I didn't want to come today.
Why not?
Well,
Oh, but you still came.
it's been a job getting here and parking outside. This is ridiculous.
Yeah. Isn't there a bay outside?
I think you should have a couple of disabled parking.
Isn't there one at the front of the surgery?
There's cars there.
Oh, sorry about that. So other than all of that, you're okay?
No.
You're not?
I don't feel well. No.
Oh. I'm really sorry to hear that. There was me thinking I could brighten up your day a bit.
Well, you have, really.
Oh, good. I knew I'd get a smile.
Yeah. I've not long had a blood test, anyway. Not long ago.
It wasn't me, was it? I haven't seen you for a while.
No, it wasn't you.
Been seeing someone else behind my back.
Yes. You weren't on the ball, not that day.
Right, I'll remember that. There we go.
Thank you.
Okay.
Lovely.
All right, nice to see you, as always.
Well.
And don't let me hear if you've seen anyone else for your blood, all right?
Yeah, hope you don't.
Take care. So, I mean, obviously, a concern, have you made plans at all that's in terms of suicidal? Have you had thoughts on that?
No, I use CB technique to sort of keep them at bay.
So you don't think there's any risk?
No real risk.
And
Or
are you-
self-harm, no.
Okay. Are you on your own now?
Yes.
The drugs are less effective in mild to moderate depression, but you are actually coming out as being quite severely depressed in terms of the ratings on the scale. So is that's what you would like to do?
Yes.
Yeah. In terms of the CBT, do you want to pursue what you are doing? Do you think you might benefit from being referred for help to see a psychologist?
I think I could, yes, I could certainly benefit from it.
Okay, so that's kind of getting things going in terms of the depression. Can I do your blood pressure?
Of course.
Okay, that's fine. Do you get out of breath when you're walking?
Yes.
Is that
at the moment I do. No, it's not normal. It's only since I put on all this weight.
Okay. Can I listen to your chest? If you stand up, can you lift your things up so I can listen? Yeah. Okay. Take some big breaths in, Nat. Okay. Listen. Okay, that's fine. All right. Maybe if you just slip your shoes off and I'll weigh you as well. Okay, if you just step up on here. Okay, that's 111.15, 17.5 stone. Okay. Right. What we need to do is, I'm not quite sure what's going on with you physically. You may have developed a condition called atrial fibrillation. That's not the end of the world. It's not like your heart is about to stop suddenly, but I think it may not be pumping quite as effectively as normal, which may be the reason why your feet swelled up before. And it's not doing a bad job now, and that's why they've gone down again. But we do need to kind of establish exactly what is going on. So you need an ECG, which we can do here, but you'll need to book an appointment to have it.
Right.
And we should do some blood tests as well. So I think I'd rather like to see you next week, actually. Really.
Yes, that would suit me, because I've got to be away the following week.
Okay, fine. I haven't really got to grips with the physical side yet, because we were speaking at the beginning about the depression. So unfortunately, in a week's time, you're probably not going to be any less depressed, but at least we're making some progress.
Thank you.
Good afternoon, Alicia speaking. How can I help?
Can I give you a project?
Of course.
Apparently, Gloria can do ECGs anytime now.
Oh, wonderful.
So that can come off.
Yep.
So can you liaise with Nurse Sarah
What she
about
can
is
do.
there anything Vivian can't do?
Okay.
Yeah?
Hi, Malcolm. Hi, come on in.
How are you?
Yeah, not bad. Have a seat.
So,
You've been for your hearing test.
yeah, they said that I had poor hearing in the high ranges, high tones, and she suggested hearing aids. And I said, how much does that cost? She said, you get it from NHS. I said, yeah, go for it.
Yeah.
So I'll have it. So
they're going to fit you.
yeah, I'm going to go up for fitting next week.
Brilliant.
And look, before I forget, I want to ask you about one other thing.
Sure.
Actually, two other things. It's totally unrelated, but I'm getting, I have a little I've had a lump at the base of my spine.
Okay.
It actually gets painful to sit.
Okay.
It's right. It's on the left side of the bone.
Show me.
Yeah. And it's not so bad right now, but I thought I'd ask you. I meant to ask you about it last time. But let me just see if I can.
Oh, I can see. Okay, if I just get you to stand up a second. No, if I get you to stand up and just spin so I can use the light here on it just to. Great.
So it is about. Where is it? Here.
Yeah.
Is it?
Okay. Yeah, I can see.
I just put stuff on it and I adjust my diet so I don't eat inflaming things.
Yeah, so I think it's just a bit of an inflamed kind of hair follicle. And sometimes what happens is that they just form a little pouch around them, and which from time to time it can just get infected. It's kind of obviously a naturally kind of sweaty, slightly dirty area, so it's really prone to that happening.
Oh, okay.
I would just
Not worried
leave
about
it there. Unless, sometimes they can swell up and become really painful.
Yeah.
And if that's the case, then we'll do something about it. But leave it as it is. It's probably the
My
best
wife
thing.
said, it's probably a cyst. Get used to it. You know, my sister has cysts. And the other thing is that I'm using some Chinese herbs
Yeah.
because I've got a strong coronary heart disorder history in my family on both sides. Okay. My father died when he was 58. My brother had a heart attack. My uncle, who was a GP, he died when he was 37 of a heart attack.
Okay.
And my mother had a heart attack. So there's a strong
strong history.
Yeah, strong history. I've had various heart checks, and my doctor's been following it. And the last check I had was about calcification around the heart.
Yeah. I'm quite wary of your family history. That's quite marked. So what I would like to do is refer you to see the biochemists. They're the ones that can do the test. So they're kind of very good at cholesterol and all that kind of stuff with it.
NHS is great.
And I think that's probably what we need to do, because I think even if it's not doing anything with the Chinese herbs, or even if it is doing something, is the rest of it being managed properly? Is there anything else that we need to be doing? Heart disease is really common throughout the whole population, but in someone like Malcolm, where huge numbers of his family had had it, and particularly at a young age, it was a real indicator that he would need special treatment to try and minimise his risk factors. Lots of medical conditions have a genetic background, which something maybe that you've inherited from your family. And so understanding what conditions potentially run in your family and therefore may affect you is really important.
Hello, hi, come through.
On 3 occasions in the last 6 months, I've met people randomly who've said, oh, you've got Marfan syndrome. Now, I had a small bowel resection in '97, and when I was in hospital, that was when a consultant came in and said, you've got Marfan syndrome, and my parents were like, oh, Jesus, not something else. Now, it was kind of borderline. I didn't have a DNA test, but they did the ECG. I mean, I've got a really high palate, hyperextension. My joints are starting to feel like other people. An ex-girlfriend of mine had Marfan's.
Right.
So I know quite a lot about the condition, and I think that I would like to get a second opinion about it.
Marfan syndrome is quite a rare genetic disorder. It's inherited in an autosomal dominant fashion, and that means that a parent with Marfan syndrome has a 50-50 chance of passing it on to their children. It affects approximately 1 in 10,000 patients. So in a practice this size, we'd expect to have 2 or 3 patients with Marfan syndrome on our books.
If you've got Marfan syndrome, then yes, you might need
What's the only definitive proof? Is it DNA?
I'm not sure. Okay. Have you looked it up?
In terms of the physical similarity, my grandfather and possibly my father have it, but my dad's put on loads of weight because of his he's got rheumatoid arthritis, but my grandfather looks classic Marfan syndrome.
Does he? So there probably is a family history.
But obviously he would never have known.
Let's say if you did have a family history, you need to have one of the major and 2 of the minor.
Right.
So one of these, an enlarged aorta. So obviously we're only going to know about those if we do a scan. A family history, at least 4 skeletal problems such as flat fetal scoliosis, and
I've got these minor criteria. So I've got this, but probably none of
so
these.
you've got all the minor.
Yeah.
But I think the family history alone is one major criteria.
But that would never have been proven because it was my grandfather.
The classic person with Marfan syndrome is usually very tall and thin. They have maybe hypomobile joints. They may have flat feet. They can get curvatures of the spine. Their breastbone may be sunken in or it may protrude outwards. They're often short-sighted and they can have problems with their vision. It affects their heart, so they sometimes have valvular abnormalities. In particular, it seems to affect the mitral valve, which can obviously cause problems. And one of the most lethal complications of Marfan syndrome is that it can affect the aorta, which is the major blood vessel in the body. It can tear and it can dilate and potentially burst or rupture, which is potentially fatal.
I mean, I'm not that bothered. I just don't want to drop down dead, you know. And sometimes people with Marfan do, from what I've read.
Well, I think you're right not to be bothered. That's fine. I wouldn't want you to be worrying about it because there's no point. It's important for your health because it does mean that we can monitor certain parts of it, which would be the bits that you're worried about. Also, for the future, if you're thinking of having children, etc., it might influence sort of your decision and sort of antenatal, prenatal screening, etc. So I think it would be useful to know.
As you know, I'm an alcoholic and I've stopped drinking. I've not had a drink for a month now, and I've stopped taking sugar in my tea and coffee and blah. And my belly just seems to be swelling up, and every time I seem to be looking at it, it just seems to be getting bigger and bigger.
Right. Okay.
I was assuming it'd be the other way.
Yeah. Okay.
Because I've not had no alcohol in a month now. Well, just 2 days under a month.
Right. Okay.
I just don't know whether something might have been enlarged or.
Yeah, okay. So maybe if you can get up on the couch, take your shoes off and lie up on here. Okay, so a lot of the swelling here is actually fat.
Right.
It's just because you can feel it. Another big breath in. Okay, that's fine. I mean, okay, fine. If you like to get down, certainly people who drink really heavily are likely to not eat well. And if you stop drinking, you might actually eat better.
I am eating better, yes.
So it's conceivable you're putting on weight because you're just eating much better because you're not drinking. That's possible. Certainly what I can find with your tummy is there's a lot of fat. The thing we'd worry about with you is, do you have liver disease? Is that causing your tummy to swell up?
Big R. And then you noticed you had the stools went back to normal, but they were very pale in colour.
They were grey.
They were grey.
Look like pretend poo that hasn't coloured in yet.
I've had some sort of sensation in the rear of my jaw.
And sticky tongue out with lip from side to side. That's great.
It's like I was pooing in black and white.
Okay.
Swollen up under my chin.
Got a little lump there.
Yeah, yes.
I wouldn't say there's anything to worry about there, which
No,
is
that's
probably
good.
what you want to hear, isn't it?
What's the symptoms? I've been told 10 days of a cold and a sore throat.
Yeah, I had a cold for about a week, and then that's gone away a bit. But I can just feel there's something sort of gummed up there. It's making my eyes feel very tense. It's making my teeth hurt.
Okay.
It feels like just pressure. I just can't seem to get rid of it. I thought it would go away, but as you can hear, it's like, I can't quite get rid of it.
Okay.
It's horrible.
Okay, well, let's have a little look in your mouth if you open
Okay.
up nice and wide. And I'm just going to press down on your tongue for a second to see at the back. Sorry. Sorry, no, it's not very pleasant, but it all looks okay.
How do you kind of triage people when they come in? Because when I spoke to the doctor earlier, I said, I'm sure I could be seen by a nurse. I'm not dying. Because your time's really valuable. You should be dealing with people who are really ill, not people like me, kind of not quite time wasters, borderline.
No.
And, why can't we just see a nurse?
Well, you spoke to one of the doctors on the phone, so in
Yeah,
answer to your
which was
question,
great.
it's sort of the doctor that does the triage, but if we then triage in to see a doctor, or we say to you, no, you can wait a couple of days and we'll book in a more routine appointment. But I take your comments on board.
No, because I tried to help and
Yeah.
sort of said, I'll see a nurse, it's fine. The nurses will know if actually you should see a doctor, presumably. So I'm never quite sure why you come straight and see a GP.
Many patients share Anthony's views that nurses should be empowered to do more. Patient satisfaction levels with nurse consultations are consistently high when it is studied. Nurses provide a very safe, effective consultation for many minor illnesses. As long as they have an effective consultation and an effective diagnosis and outcome, most patients do not actually mind who it is they were seen by. So that's sort of our
No, it's just
system.
that this surgery is really good, it's so much better than the one we were at before, and you kind of want to make it better. And so you sort of think, well, I just don't need to see a doctor, because being blunt, you're expensive. And, minor stuff should be dealt with by somebody who can just, put stuff together or whatever.
You've never had liver disease
No.
really in the past, so it's not at all likely that it's going to suddenly
Because I've
start
always
out.
sort of had a bit of a belly, but it just seems to be getting a bit bigger now.
Yeah. Can you just if you take your shoes off for a moment, I'll weigh you. How do you feel in yourself since you stopped drinking? Do you feel better?
To be honest, no, I don't.
Stand on the scales. So that's 86.85, okay. So how do you feel?
Well, I just feel sober. I don't feel drunk. It's. I'm waking up and I'm not groggy. That's one difference. I'm just living in the normal world, I suppose.
Okay. Is this permanent? Are you?
What's that? My girlfriend has been taken into hospital in a bout, but she was a drinker, like a binge drinker, and it looks like she's got liver failure, which is bad. She's gone, and that's put a thing on it for me and said, well, if that's what alcohol's going to do to you, I'd rather not have it. You know what I mean? So it's long term.
That's fantastic.
It's been an eye opener, and I'm not getting any younger now. You know what I mean? So.
Okay. So as far as your tummy is concerned, there's nothing that I can actually identify at the moment other than that it's fat.
Because obviously what we're hoping for now is that your health is going to really get better, and it's kind of like a fresh start.
So we're taking the left in here. Okay. Rightio. Okay, how can I help?
What is my left breast? Occasionally I get a bit of pain, and sometimes deep pain I feel. It's not all the time, it's on and off.
Okay. And you came in a couple of weeks ago, you said?
Yeah.
Do you mind if I have another look, just to make sure there's no change since then?
Sure.
All right. So, come on over.
You just want top off?
Yeah, if that's okay.
Yeah, sure.
Fab.
Right down? Or?
Yeah, if you wouldn't mind, that'd be good. Okay, you on there? So, I'm just going to ask you to pop your...
ticklish.
Are you? Well, I will try and not tickle you. Can you pop this arm above your head for me? Is that okay, or am I tickling or hurting?
No.
Or both? God, am I tickling you?
No, well, sort of, I get ticklish. You're not tickling.
I
but
tell
it
you
just-
what,
Yeah.
if it hurts, yelp. Otherwise, I'll let you laugh.
Okay.
Okay. Gosh, I've never met anyone quite as ticklish as you. Just gonna feel in your armpit as well. Sorry, I'll be as quick and unticklish as possible. All right. Can I feel this side as well, just to make a comparison? Lovely. Oh, bless you. I don't know how you get on every day being this ticklish. Just check your armpit again. I'll be quick. All right, that's fine. Okay.
No lumps.
Let me give you your bits and bobs back. There's no lumps or bumps or anything like that I can feel, which is all really reassuring. But if this pain has kind of persistently been here for a good few weeks now, then certainly we can refer you in just to double check that there's nothing untoward happening. So we're going to refer you for the breast. Okay?
All right, thank you very much.
Fab. Is it your husband waiting for you?
Yes, it is.
Oh.
Mhm.
So we're turning right.
Okay, they should be ready after 4 tomorrow. No problem, you take care.
Bye.
Oh my word. Please present a mobile repayment after next doctor's certificate. Asked to come with self-certificate. But think she needs a doctor's certificate now. Yeah, that was just getting too...
She just wants time
She
off
just-
work.
yeah.
Just say, I'd rather you call and say, girl, I need some time off work. I need a doctor's certificate. Can you get someone to call me today? End of discussion.
Bye-bye.
Thank you very much. Thank you.
Bye-bye, Liz. See ya.
All right.
Thank you very much.
Okay. And I'll see you soon. Take care. Bye.
Again.